somewhere there has been, as a consumer, there is a lot of confusion on what is the medicine to take. Someday they take plasma therapy, then they say, no, that's bad. As per the latest guidelines, whether remdesivir is supposed to be taken or no. So I think there is this huge confusion in the minds of a consumer of what is actually the therapy to be given. And then because suddenly somebody talks about a therapy, everybody's trying to buy those medicines. So what is happening, and what could the government do differently so that this is not repeated again?
To be fair, things have evolved over a period of time, right? I mean, I remember back in March of last year, HCQ
everybody
was the biggest buzzword. I mean, Emcure, we made 2-3 crores of HCQ and gave it free everywhere. And then after a few months, it's like HCQ doesn't work, right? Then, of course, there was tocilizumab and itolizumab and bevacizumab, all the MABs that came in. Then there was remdesivir, and then, there was a lot of confusion over favipiravir works, doesn't work, should we give it or not? And then, of course, there's amphotericin. So I think things have evolved over a period of time. But given where we are right now, where we've had 2 waves, there is a lot of clarity in the doctors' minds. So while patients may not have the full picture, I think doctors, when I speak to a lot of doctors, because my job is to interact with a lot of doctors, there's a lot of clarity in their minds in terms of, scenario A, if these are the symptoms, these are the medicines. Scenario B, if this is the SpO2 and this is the HRCT, this is what you do. So I think there's a lot more clarity now than there was before. And to be fair to them, before, like I said, there's been no rule book or a playbook for COVID. So it's been a little bit of trial and error as well. Plasma therapy is another example, which there was so much buzz around it. And then there was a notification that came a month back saying it doesn't work. Don't even bother. So I think it has been a lot of trial and error. But at this point, as we are talking, there's a lot more clarity with doctors, which is good for us.